There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, what are the reasons for high blood pressure at a younger age? The heart is a muscle that pumps blood around the body constantly, during every second of our lives. Blood that has low oxygen levels is pumped towards the lungs, where oxygen supplies are replenished. The oxygen-rich blood is then pumped by the heart around the body to supply our muscles and cells. The pumping of blood creates pressure, blood pressure. Causes of high blood pressure. 1. Smoking. Smoking causes the blood vessels to narrow, resulting in higher blood pressure. Smoking also reduces the blood's oxygen content, so the heart has to pump faster in order to compensate, causing a rise in blood pressure. 2. Alcohol intake. People who drink regularly have higher systolic blood pressure than people who do not, according to researchers. They found that systolic blood pressure levels are about 7 mm Hg higher in frequent drinkers than in people who do not drink. 3. High salt intake. Researchers reported that societies where people don't eat much salt have lower blood pressures than places where people eat a lot of salt. 4. High-fat diet. Many health professionals say that a diet high in fat leads to a raised high blood pressure risk. However, most dietitians stress that the problem is not how much fat is consumed, but rather what type of fats. Fats sourced from plants such as avocados, nuts, olive oil, and omega oils are good for you. Saturated fats, which are common in animal-sourced foods, as well as trans fats, are bad for you. 5. Mental stress. Various studies have offered compelling evidence that mental stress, especially over the long term, can have a serious impact on blood pressure. One study suggested that the way that air traffic controllers handle stress can affect whether they are at risk of developing high blood pressure later in life. 6. Diabetes. People with diabetes are at a higher risk of developing hypertension. Among patients with type 1 diabetes, high blood sugar is a risk factor for incident hypertension. Effective and consistent blood sugar control, with insulin, reduces the long-term risk of developing hypertension. People with type 2 diabetes are at risk of hypertension due to high blood sugar, as well as other factors, such as overweight and obesity, certain medications, and some cardiovascular diseases. 7. Psoriasis. A study that followed 78,000 women for 14 years found that having psoriasis was linked to a higher risk of developing high blood pressure and diabetes. Psoriasis is an immune system condition that appears on the skin in the form of thick, red scaly patches. 8. Pregnancy. Pregnant women have a higher risk of developing hypertension than women of the same age who are not pregnant. It is the most common medical problem encountered during pregnancy, complicating 2% to 3% of all pregnancies. I hope that helps. If you need more answers and advice on hypertension, I've included some links in the description.